So what's just happened is the government has agreed the prioritisation for when the vaccines come in. We have a group of experts called the National Immunisation Advisory Committee, NIAC. They did a report for the National Public Health Emergency Team, NPHET. It went from NIAC to NPHET to me. I brought a memo to government to say this is what the experts recommend. So we've now got agreement on who would get the COVID vaccines first. Who gets the COVID vaccines first? Essentially, the experts asked a really important question, which is how do we save as many lives as possible and how do we stop people getting really sick from COVID? So using those two questions and then 4 ethical principles, they came up with 15 different categories. And essentially what they've said is the first group of people who need to get the vaccine are people who are over 65 years of age, who are living in nursing homes or other long-term residential care facilities. Why? Remember back to the first wave, more than 1 in every 2 people in Ireland who died from this awful bloody disease were people over 65 living in these settings. So they're first. The next group of people is healthcare professionals, frontline workers who are dealing directly with patients. Remember, we've had quite a lot of COVID cases that healthcare workers have got. 1 in every 5 COVID cases is from a healthcare worker. We need to protect them. We need to protect the healthcare systems that they run, so they're next. From that then, it goes down in terms of ages, how vulnerable people are, how likely people are to get it, right through the categories. What's happening next is this. There's a task force has been brought together to figure out exactly how we distribute the vaccines, bring them in from overseas, get them out around the country, and ultimately administer them to people. They're doing a lot of detailed work now this week. They're reporting into us on Friday. We're going to look at that very carefully, bring that to government next week, and then publish it for people to take a look at. When are we likely to see the vaccines? A lot of people are asking. So our regulator is the European Medicines Agency. The first vaccine they're looking at is a vaccine from Pfizer, and they've said that they're going to meet up on the 29th of December at the latest and give an opinion as to whether or not they are saying yes or no to the Pfizer vaccine. If they say yes, and we've seen the UK regulator has said yes, if our regulator says yes, then it'll only be a matter of days before we have the vaccine ready to go, and obviously we'll be starting with the highest priority people with that vaccine. How much is the vaccine going to cost for people? 0. What we did with the flu vaccine is the high priority groups, they got the vaccine for free, but other people could pay for the flu vaccine if they wanted. With the COVID vaccines, the answer is the state will pick up all costs involved. What should we all do now? Well, the advice that I'm going to give is the advice that the public health doctors give me in the department here every single day, which is keep following the level 3 measures, keep following the basics. Even in the last few days, the number of cases has begun to go up again in Ireland. Now, we knew that was going to happen when we moved from level 5 to level 3. But what the public health doctors are telling me every day is that we all need to keep following the advice. And even though we need to live well, we need to enjoy December, we've still got to manage our social contacts and meet people in the right ways. So how are we doing in Ireland on COVID? The answer is we're doing incredibly well. So we've had the biggest fall in COVID cases in Europe. Right now we have the lowest 14-day incident rate in the European Union. We also have one of the biggest falls in COVID deaths between wave 1 and 2 anywhere in the world. It's an incredible achievement. The thanks goes to the people of Ireland for following the public health advice, for taking care of each other, for minding each other. And what the public health doctors are saying to me every day is we need to keep that spirit up, keep looking out for each other through December and into the new year.